Welcome back to Alabama News Network this morning. It's Wednesday, so that means that Dr. Kathy Lindsey is here. We're going to take your calls if you have a healthcare question, 1-800-504-4084 or 420-TALK. You can see that number at the bottom of your screen. Thank you so much for being here, Dr. Lindsey. As always, we appreciate it. We were talking last week about skincare problems, and you have a regular practice, but you also have a skincare side.
Right,
correct?
laser wellness.
Laser wellness. So wanted to talk a little more on that subject about adult acne, which is something that I feel like a lot of people, especially my age, it's like we thought we would get out of our teens and it would all go away. And that's not the case. Right.
Yeah, everybody expects it when you're young, but when you get older, it becomes a stigma. People really don't want acne, and it's very confusing. And 25% of the people over the age of 30 will have an acne breakout, and it can be very traumatic to people. They can mash it, get scarring, hyperpigmentation, and so ways to prevent it's very important. Knowing the triggers that can cause it and things you can do to help prevent it really helps.
It seems like a very prevalent type of adult acne is that cystic acne,
right?
Which is it's under the layers of skin. Now, have I read that it's actually an oil duct that gets infected?
Your sebaceous gland. What happens? What causes acne is an increase in sebum production that occurs in a gland at the end of the hair follicle, and it produces oil. Sebum's the oil, and certain things can trigger that opening to that oil gland to get smaller, like menstruation. When we're on our cycle, women are on a cycle, that increases sebum production, but also decreases the size of that little pore, and so that gets clogged up. Dead skin cells get clogged in there, and you get the bacteria, the acne bacteria, and inflammation, and you have the cystic nodule that develops.
Oh, and it's very painful, and you can't mash it. What is the answer?
Well, the main thing is gently cleanse. Make sure you still moisturize to protect that layer. And there's certain products that you can use to help prevent it from coming, like your retinol products, your retin-a that helps exfoliate it. And when you have one, if you mash it, it's going to trigger more, so keep your hands off of it. And there's certain procedures that the dermatologist or family medicine, internal medicine physician that's used to doing those procedures can do. Laser procedures, little mild injections that can get rid of that cyst.
All right, we have a question.
Great.
You're on with Dr. Lindsey. Do you have a question for her?
Hello?
Hello.
Hey, go ahead.
Dr. Lindsey, I know that chicken pox, whatever, the shingles versus in the body, but once you get shingles for treatment?
I think he's saying, he's going in and out a little bit, but he's saying once you have chickenpox, the shingles virus is inside you. Is there a treatment for shingles?
Yes. The chickenpox virus does stay dormant, and certain things trigger that virus to become activated again. Stress, decreased immune system. You treat it as soon as you have anything that comes up that could be painful or a rash with antivirals. Certain ones are Valtrex. The sooner you get it, the better it resolves, and the less likely you'll have a chance of prolonged pain afterwards, even if the rash goes away.
All right, we have another question. You're on with Dr. Lindsey. You have a question for her?
Hello?
Yes, I was asking the question about having a freckle.
A freckle? Is that what you said, ma'am? Like a dark freckle?
Yes.
Okay.
I have freckles on my face that I was born with. I guess, later on, I guess it's a genetic thing. And when I got to be the age of 20, they started coming on my face.
You're wanting to get rid of those freckles, I'm guessing?
Yeah, because they're on my cheekbones and freckles and moles I've had for.
Is there a treatment?
And it become more and more as I get older.
Right.
And it would be harmful for the remove. I'm a diabetic, and I have high blood pressure.
Okay.
Yeah. Well, freckles, depending on skin color and skin type, can be treated in different ways. Certain fading creams can fade them. If it's a raised freckle, which I think what she's talking about, that's a dark mole-like keratinized mole, it can be removed with cautery or laser, but you have to be careful not to hypopigment the area. So see a dermatologist or see your medical physician to let them evaluate it. But there are ways to fade them or get rid of it.
For people who do have freckles, I know, people who are very fair-skinned or have red hair or something like that, is there any way to keep from getting those freckles? Because it's the sun that gives them to you, correct?
Well, a lot of it's genetic. I mean, you're born with that melanin production in that certain area. Melanin is what causes the pigment in your skin. And our heritage, our genetic background predisposes us to a lot of that. And certainly, sun can make it darker. So wearing a sunscreen and certain fading creams can help lighten them. But to totally get rid of freckles, I wouldn't advise procedures to totally get rid of them. But you can fade them and lighten them.
Pesky genetics there. I hate
but freckles
that.
can be cute.
They can.
Yeah,
I agree. I think that they are.
definitely.
Dr. Lindsey, she owns Alabama Family Practice and also Alabama Laser Wellness.
That's it.
All right. Thank you so much for being with us. We appreciate
You're
it as
welcome.
always. We'll be right back.